Welcome to the Dermastore Podcast.
A chat about all things skincare, skin health.
And if you're a real skin nerd, we hope you'll join the conversation. Welcome to the 7th episode of the Dermastore Podcast. Hey Lara, what's happening?
Good morning, Greg. I'm great, thanks. How are you?
Very well, thank you. Very chilly day here in Cape Town. Been raining a lot.
Oh, I love it. Someone told me once that it's so nice to live in a city because I'm from Johannesburg and it really does. The sun shines 365 days a year. And so you don't really feel the season change, even though winter's bitterly cold. Cape Town, the seasons change.
And that's what I love about Cape Town, because there's a different mood for every season. I really enjoy running, and I run on the promenade maybe 3 times a week, and every morning seems like a different run.
Yeah, and the wardrobe, and it's the environment, the mood.
Yeah.
So it's been cozy and cold and wet, but it's been wonderful.
Yeah. So let's kick off today's very important episode with our tradition. What did you use this morning?
This morning, we have had a lot of fun with testing a very unusual type of product for us, with a cleansing product. So I used this cleansing bar.
Okay.
And sure, it took me way out of my comfort zone using this product because we traditionally use, gel cleanser or a foaming cleanser. So I used that as my cleanser this morning, and then I used CE ferulic as my morning antioxidant, which was... I don't know if if it's just in my mind, but I was like, oh my gosh, look how radiant my skin is looking.
It's amazing if you just use that product every day for like a week, what the transformation your skin goes through.
Yes, so I'm so happy that I'm using that. And then I used the Jogob white tea balancing cream, which, it just goes on like a dream. And then I used La Roche-Posay UV Immune 400 Invisible Fluid.
Okay, cool. I'll actually add in a little bit of shampoo and conditioner in this one. This Dr. Barbara Sturm anti-aging shampoo, which is fantastic. It's very low foaming, which I love. I think way too many shampoos are too focused on surfactants and strip your hair. I find that a lower foaming shampoo that offers quite a lot of hydration works, and it almost feels like a skincare product that you're putting on your hair, which I love that sort of synergy between skincare and hair care. I always say the two should work hand in hand, and then the conditioner is also very nice. And then I just used the CeraVe cream to foam cleanser, and I kept it very simple this morning I wanted to test a new serum that we've launched on Dermastore on its own, and I didn't apply anything else. Yeah, and that was the Endocare. Is it the hydrating serum?
Oh yes, the hydrating protocol, part of the protocol
shots.
Yeah.
You know why? I just wanted to test what it would do on its own.
And how are we going?
It feels good.
Excellent.
But it was feeling good going into after cleansing, so it wasn't feeling tight or dry. I think that's because of the CeraVe cleanser. But it's so far so good. Right, so kicking off today's episode, we are talking about hyperpigmentation. We're calling it the Hyperpigmentation Playbook. Everything you need to know in one podcast session, which we'll just cover the most important topics on this. It's obviously a very large subject, but we do think it's going to be helpful for customers who are struggling with various types of hyperpigmentation, what to look out for, and the kind of treatment protocols we would recommend. So joining us in the podcast studio, once again, our in-house dermatologist, Dr. Ian Webster. How are you, Dr. Webster?
I'm well, thank you.
Thanks for joining us again. How would you describe hyperpigmentation? I mean, can you define it?
So hyperpigmentation just means dark marks on your skin. So it could be on your face or your body. Hypopigmentation is paler marks. So that's all it means. So hyper is darker marks, of which there are quite a few causes.
I think that's the challenge here is how do we get hyperpigmentation? And there are so many triggers that are causing the skin to change in color.
Yeah, exactly. So in each one, that's why it's important to have a proper consultation to identify which type of hyperpigmentation you have, because the treatment of each one is slightly different. And I can just list them. There are freckles, there's solar lentiginous, there's melasma, and there's PIH, or post-inflammatory hyperpigmentation. So we can discuss each one of those.
hyperpigmentation, so the darker marks in skin, is it different between a darker skin tone versus a lighter skin tone? Why do they present differently?
They do. People with a darker phototype, if you get bitten by an insect or get a burn, that's the way the skin reacts. Because you've got more melanin, you get more likely, a person with a darker skin type is more likely to leave a brown mark if you have a burn on your or insect bite. It's just it's a fact.
Because they have more melanin present in their skin.
Yeah,
Okay.
and the skin is more reactive.
Okay.
Yeah.
And so in a lighter skin, we do see pigmentation, hyperpigmentation, but it might take longer to see that pigmentation.
Yes,
or it might not be as visible or as dark.
Exactly. So people with a darker phototype might have mild acne, but it leaves a marked PIH. So they might have the initial disease might be mild, but it leaves disfiguring post-inflammatory pigmentation.
It's almost a form of a scar, isn't it?
It is, yeah.
Okay.
Yeah.
Is it true that hyperpigmentation is very closely linked, and we've just touched on this, to inflammatory skin diseases?
It is.
And
It is.
because they have a similar mechanism within the skin, the melanocyte, which is producing melanin, similarly to the Langerhans cell, which is sort of your fighter little cell, your inflammatory cell, they're both responding to injury to the skin.
Exactly. So it is even melasma now, more research has shown it's related to inflammation.
Wow.
So a lot of the ingredients we use have got anti-inflammatory properties.
Okay, so they have multiple functional
Exactly.
benefits.
Well, that can be used as preventative treatment as well.
It can, definitely.
And that's, I think, the best place to start.
I don't think we focus on that enough.
No.
There's some brands starting to do more, focusing more on that, and I think that's great. And at least this way, if you know you're prone to it, so almost all darker skin phototypes should be using some sort of anti-inflammatory care.
Yes, and a preventative thing. If a woman with a darker phototype is pregnant, she must be meticulously use the correct sunscreen.
Yeah.
Because obviously prevention is better than treatment.
Absolutely. And more cost effective.
Yeah, exactly.
So let's quickly kick off with a simple one, and then we can go into the slightly more complex hyperpigmentation skin disorders. But for example, my best friend, her face is speckled with freckles. And so I just want to sort of clear up the idea of freckles is not something that you actually can remove completely from your skin.
So it often occurs in people with a sort of Celtic reddish blonde hair and freckles or Irish extraction. And it's a sort of physiological thing. So it often occurs in children. Most times adults, often the freckles fade. And I have people who come to me, patients, who say, I want you to get rid of my freckles, but you can't really. Often the freckles will get darker in the summer and paler in the winter. And some people just don't like them. You can do laser like IPL. That will temporarily lighten the freckles, but they will come back again. So I generally tell the patients, accept it.
Learn to love them.
Yeah, exactly. So do sunscreens work for freckles?
Yes, it'll prevent that darkening.
Yeah.
If you use that sunscreen, your freckles are not going to go dark in the summer.
Okay.
Yeah, because it's seasonal. Your freckles by definition are paler in the winter, darker in the summer.
Okay. So sunscreen is what we're looking for here. Okay, great. And then solar lentigines, or the easier layman's term, sunspots. Could you tell us a little bit more about these?
Yeah, so that is from the sun. So they're freckles that often occur in the exposed areas, often on the face and the back of the hands. You know, people sometimes call them liver spots or age spots, but they are it's from chronic sun exposure. And they're often round, brown little lesions on the face and the back of the hands. And they are fairly easily treatable with, you can do cryotherapy, freeze with liquid nitrogen, or you can do IPL laser. The problem is sometimes some darker freckles can become malignant, and they can develop into something called lentigo maligna, which is the earliest stages of a malignant melanoma.
And do solar lentigines affect all skin tones?
It tends to occur more in people with a fairer skin, with more paler skin.
And that have been exposed to a lot of sun
So it's usually
exposure.
on all the exposed areas, often on the face,
Back of the hands.
and often drivers of a car in South Africa, it's often more on the right-hand side of the face.
Okay.
Yeah.
It's something that, and you mentioned such a valuable point, Greg, of prevention, because I know that I have that typical skin tone that needs to prevent those sunspots from developing, especially on my hand. Like, I don't want those aged hands. So I've become really self-conscious and aware of using sunscreen on my hands and my chest, and of course my face.
Exactly. So I think that's something we all need to take note of, is prevention is better than cure. But let's move on to the next big one, which is melasma. How do I know if I've got melasma?
So melasma usually occurs in women, and it's essentially, there's a couple of trigger factors: hormonal factors, pregnancy, estrogen-containing contraceptive pills, sunlight, and it's your skin phototype. So it tends to occur in people with a darker skin.
So you've listed quite a long list now of what the triggers could possibly be. And I would really want to stress this to our listeners, is that melasma is a multifactorial skin condition, and that there's no just one sort of reason as to why that we can eliminate and all of a sudden your melasma will fade away.
So there are essentially just two types of melasma. There's what we call epidermal melasma, where that pigment is just sitting in the epidermis, and then the longer the melasma is present for, the pigment falls from the epidermis into the dermis, and that's called dermal melasma, and that is more difficult to treat. And often people have a combination of what we call epidermal and dermal melasma. So a woman might fall pregnant, get a bit of pigmentation, and then use a sunscreen, and that epidermal form of melasma can actually disappear on its own.
There was actually that clinical study that we had researched recently, that they did a trial with pregnant women that were just using mineral sunscreens during their pregnancy period, and the reduction in melasma, or the onset of melasma, was drastically reduced just from wearing a sunscreen.
And what are the kind of ingredients and products you would, I mean, obviously there's a full spectrum of treatment. You can't really do chemical peels or lasers with melasma, especially in darker skin types.
No, I don't like doing that. So number one, the patient needs an assessment. You know, in my rooms, I take a history. So if, for instance, the woman is taking an estrogen-containing oral contraceptive, I would maybe recommend that be changed for something else. And then you do emphasize the sunscreens. And for melasma, you want a broad spectrum sunscreen, one that covers high energy visible light. So it might need a bit of iron oxide, and the newer generation sunscreens with the longer UVA filters. So you must use a good sunscreen. And then in my office, my mainstay, especially if I think it's dermal melasma, I do prescribe hydroquinone. But that's got to be given under medical prescription and medical supervision. And that works extremely well. And then
so sorry to interrupt. So that's just an acute treatment, hey?
Yes, yeah.
Okay.
We generally use it for maximum about 4 to 6 months.
And actually, that's a great treatment protocol that I know that you encourage and prescribe. But the most important protocol is the one thereafter, hey?
Exactly. So because it's a chronic relapsing condition. So unfortunately for dermal melasma, there's no quick fix. You know, it's a chronic condition. I'll often start off with the hydroquinone, and then I will wean the patient onto a non-hydroquinone product. And then we've got, on Dermastore, we've got so many different fantastic ingredients, you know, like tranexamic acid, azelaic acid, niacinamide. They're fantastic, and there's various combinations.
Exactly, and we like to recommend, like you mentioned, taking a history and getting a background as to how this patient's melasma has become will often guide us on how we recommend and what we recommend to the patient. If it's, I don't think you get such thing, but full-blown melasma, you know, it's quite a comprehensive day-night regime for them to use, including their sunscreen. And I try push it and tell them to use it 3 times a day. Treatment can become quite complex. And so what is the biggest thing for a patient who's about to start their melasma treatment?
Well, I think is to understand if they've got dermal melasma. This is a long process. It's not a quick process. To have realistic expectations. It's a chronic process, and you've just got to get into a regime that suits you. And again, I think depending upon your skin type, you might want a non-hydroquinone product that's more a serum. Some people might want a cream, and obviously at different price points, But you've got to be consistent, and you've got to use that sunscreen regularly. I always say to my patients, if you just have one day in the sun without proper sunscreen, you're back to square one again.
Way.
Then you start the process from the beginning.
So you started your treatment in January. We had a bad sun day in July. I'm going back to January.
Exactly. And often the patients will tell you,
wow.
I was on holiday in Greece, or I was on holiday in a sunny place, and that one day I didn't put sunscreen on. I remember that day.
Wow.
And then now I've got the melasma.
That's devastating for a lot of people, I think, because you go to all that time, effort, and energy and work. But yeah, I think focusing on routines is so important. And I think one thing, going back to the preventative thing, is that if you're prone to pigmentation, use care that addresses it, and consistently. It doesn't have to bat the lights out in terms of, lots of active ingredients. But we have so many wonderful ranges on Dermastore that I can think of that can just be used as maintenance and as preventative care. I think too often people come onto our support and they're like, oh, I've got pigmentation, but it's almost not too late. But you've got to start this whole journey.
And it's very overwhelming, and it's quite scary for that patient. But let's not get there, guys.
Start young, start using care that can actually help from very early on.
So a really big skin concern that we often daily see on support, Dr. Webster, is PRH, and it's mentioned. They say dark marks, or they have blemishes on their skin, and you can typically see when we request for an image or a photo of their concern, it is typically post-acne marks. How do we treat and help this patient from the beginning?
Yeah, so I think, as I said before, often people with a darker phototype, they might have mild acne, but it leaves these dark marks. So in those patients, you've got to treat the acne quite aggressively. I tend to treat more vigorously and aggressively because I know it is going to leave the dark marks. But then they need to use products that can be preventative, and obviously they must use the sunscreens.
Okay, so it's really important, and why you want to treat the acne aggressively is because you want to prevent that PRH from coming on too strongly.
Exactly.
Okay.
Exactly.
And then what is so amazing, Greg, I mean, the products that we see now on Dermastore to help with acne have started to include skin brightening ingredients.
Totally. I mean, some of the brands that we're recommending on our support are brands like Derm. The DSP Bright Pigment Zero range has, for example, in the day cream, there's a high factor broad spectrum sunscreen. There's tranexamic acid, niacinamide, kojic acid. There's vitamin C, there's ferulic acid. I mean,
in the day cream.
Just in the
with
day
the
cream.
Sunscreen.
With the sunscreen.
That's all you need.
SPF 50. In the night cream, you've got alpha hydroxy acids, phytic acid, which helps reduce melanin synthesis, and you've got hexanyl resorcinol. So that's a powerhouse also. And then obviously in the DSP illuminating serum, which is actually more of a maintenance serum, which you would actually use post using the DSP Bright ampules, which are the main tranexamic acid treatment product in that range. The Pigment Zero serum is nice. Once you've done with the Pigment Zero Bright ampules, you would move on to the illuminating serum, and that contains hexaresorcinol, phytic acid. And I think it's really important that people start to think about routines. So yes, you can use one hero product, but actually working together with a good treatment-based product in the morning, a sunscreen, and a night product, the whole routine is going to work.
It's vital, and I know it feels like it's initially quite a big layout in the beginning, but the challenge is, and this is what we've said, and this is what Dr. Webster said, is there are so many triggers that are working 24 hours a day. It never stops. So your routine has to also work 24 hours a day. So really important that we look at this routine that is focused throughout the day and night. if we are prone to melasma or hyperpigmentation, PIH, it's important to make sure that your broad spectrum sunscreen is covering the adequate wavelengths, especially like you mentioned, high energy visible light, because that, what we've seen from studies, is what's triggering the pigmentation.
And also, I think a lot of people make with the darker skin type, they get maybe an insect bite or a thermal burn on their hand. They will put an antibiotic cream on, but then they forget to put the sunscreen on. Wow. And then it leaves a nasty brown mark. So I think that's important. Again, it's the sunscreen.
It's amazing how sunscreen is actually such a dominant treatment product.
Yeah. Yep.
Yeah. And often they will maybe use things like tissue oil or things that they think is helping for scarring, but they forget to put the sunscreen on.
And aren't there a few oils and tissue oils that actually can make the PIH worse?
They can, yeah. So a lot of botanicals, especially if they've got any fragrance in it, you can get what we call a photocontact dermatitis. So it's the oil, the botanical plus sunlight, can also cause pigmentation.
Mesoaesthetics is really strong in this category because of their concentrate with tranexamic acid.
Yeah.
It's a standout treatment ingredient. Look for the active ingredients like your vitamin C, your azelaic acid, which is a powerhouse when it comes to acne and pigmentation. So a product like the SkinCeuticals Phyto A brightening moisturizer is a key product for us with PIH. Sunscreen covering that full spectrum is La Roche-Posay UV Immune 400. They're covering up to 400 nanometers on the spectrum. And then I just think you can't go wrong with a vitamin C serum, Greg.
Yeah, I totally agree there. I mean, it just does so much. Whenever you're looking at building a skincare routine around pigmentation, include a vitamin C because we know how well it can work. Floritin in the SkinCeuticals range. Marty Derm's got a number of vitamin C ampule options. We've got so many options on Dermastore. Just have a look at our ingredients page. Vitamin C, we break it down according to skin type, skin concern, concentration, if it's a derivative, if it's a pure vitamin C.
And if you feel very overwhelmed about what Greg just said, please just pop us a message on chat support.
We want you to make better decisions for your skin health. That is our objective at Dermastore. So, yeah, any questions, we're always open to answering. Okay, Dr. Webster, any parting tips before we wrap up this episode?
I think if you've got hyperpigmentation, I think the important thing is to get a proper assessment as to which type of hyperpigmentation. So as I've explained before, because each treatment is slightly different. I think that's the most important thing. And if you have a darker phototype, I think it's important to use the right products, sun avoidance, sun protection, sunscreens to prevent hyperpigmentation. So I think that's a key, is the prevention.
Absolutely.
Thanks, Dr. Webster, and thanks, Lara, for joining on today's episode. We will be back again with another exciting topic very soon.
Don't forget to subscribe if you're keen to learn more about what we have to say. We would also really love your thoughts, ideas, and any questions you have for future episodes. You can email us on pod@dermastore.co.za.